All right, well, thanks everyone. So we'll give the COVID update first and then we'll move on to Cairns issues. So the Deputy Premier and I will discuss COVID first. So overnight I can report we have had only 2 new cases. This is terrific news, and thank you again for everyone who's going out there and getting tested. So I can confirm that one person, they're both from the West Moreton region. One person is a nurse from the Ipswich Hospital, and also remember that Dr. Young put in all those strict measures about health staff wearing PPE. So the DP will talk a little bit more about that. The second one is a student at Staines Memorial College at Redbank Plains. Now this college is closed at the moment, and of course we are in the process of testing all of the students. So there's about 600 students that attend that college, and we are working through with the parents and the staff to make sure that everyone out there is being tested. And that is the second confirmed case now from Staines Memorial College, and that person is an 18-year-old student. Now, and also in breaking news, now the Deputy Commissioner will be addressing this later on this morning. Police have apprehended a man that has come from Victoria who was known to be positive. This is great work from the police that have been able to apprehend this man who was trying to get into Queensland illegally. This goes to show how strong our border measures are and the fact that they are working. So the Deputy Commissioner will address the facts of that case in more detail. So we now have 28 active cases, and the total number of confirmed cases is 1,124, and the number of tests conducted in the last 24 hours is 7,489. So I just want to stress to everyone too, if you have any symptoms, please go and get tested. And Queensland will get through this if we all work together. So like I said, 2 new cases overnight, but police have done an absolute wonderful job in apprehending a man who is positive. So of course there'll be some contact tracing on that flight that came in from Melbourne to Brisbane, but came into Queensland positive, and that has been apprehended. And just imagine if that person had got out into our community. So my hat goes off to all of the police who are working on our borders right across our state. Well done, and the Deputy Commissioner will address that matter specifically later. My understanding is later on this morning. So I'll hand over to the Deputy Premier, and then we'll talk about Cairns. Thanks. Thanks, Stephen.
Thank you, Premier. So we are reporting 2 new additional positive cases in Queensland, but increasing our number of active cases in the state by 3 today. The first is a 37-year-old male nurse from the Ipswich Hospital. He works in the COVID ward at the hospital, and there have been COVID positive patients in that COVID ward. He identified that he had abdominal pain, which is not normally considered a symptom of COVID-19, but he was incredibly wise, and he identified that that was a symptom that could be from COVID-19. He went and got tested, and that test came back positive. It underlines how we can all do the right thing by monitoring our health, and if we have any symptoms at all that are of any cause for concern, we can go and get tested. And so we thank him very much. For that. He's from Deebing Heights in Ipswich, and he is in a stable condition. His symptoms are relatively mild. The second case is an 18-year-old male from that Staines Secondary College. He is from Redbank Plains and was already in quarantine. The third case, as the Premier mentioned, was a case that tested positive in Victoria some time ago. Victorian authorities had been attempting to locate him. He's a 48-year-old male. He went into quarantine here in Queensland. Authorities in Queensland and Victoria will now investigate whether he has committed an offence. He arrived here at 9:19 yesterday on flight JQ560. In my briefing this morning with the Chief Health Officer, I asked her what she would like me to say this morning. And she asked me to just underline that message about masks in the southeast. If you're in a place in the southeast where you cannot be physically distant, please consider using a mask. It's the best way to keep yourself safe and others around you safe.
Was the Victorian man apprehended at the airport, do you know, or elsewhere?
So he was intercepted at the airport as someone coming from a hotspot and put into quarantine. Victorian authorities, subsequent to that, advised that he was positive, and so fortunately was already in quarantine. The only concern with regards to contact tracing, therefore, relates to people who are on that flight.
Are there other people on the flight now in quarantine? The Deputy Commissioner will address it later on this morning. Yeah.
How many kids at Victoria Confidence States being tested?
I don't have the number of tests, but the school is currently closed and the students are in quarantine.
Were the other people on the flight now in quarantine anyway, having arrived from?
That would depend on their individual circumstances and the nature of their border pass.
Were there prisoners after Glory returned tests?
Not at this stage, no, I'm not aware of them.
Lockdowns?
Of course, we're concerned for the welfare of prisoners and our prison officers, but they're managing that well. The Commissioner's managing that well. Well, it's too early to go to that. We would need to see that there was no transmission in the prison for that full incubation period.
What's the current advice for students and parents in landing stations?
Well, I'm not across particular contact tracing details there, but our advice to anyone is that if Queensland Health contacts you or a school contacts you, to advise that there has been a confirmed case there, to monitor your health very carefully, to stay in quarantine if advised to do so, and to go and get tested if you have any symptoms. Well, as I say, the plan is to continue to monitor, continue to test, and if we make it through a full incubation period without local transmission, community transmission within the prison, then they'll be able to gradually move back through those stages of restrictions.
All right, we might just move on to Cairns. Might bring Sandra in as well at the moment. Okay, so as we know, Cairns in the far north is an incredibly large area, and the health of people living in this area is fundamental to my government. Since 2015, we have put on an extra 223 doctors here, an extra 489 nurses and midwives, and 126 extra health professionals. And my understanding is that the Cairns Hospital here sometimes receives around 79,000 admissions into its emergency department. So with the growth in presentations here, but also to the large area that the hospital services, the Deputy Premier and I, we have decided that we are definitely going to be working with James Cook University to expand this hospital, to grow this hospital, and to make this hospital a Cairns University hospital. We have a similar hospital in Townsville, but what this fundamentally means is that I want to see local people from the far north, I want to see them raise their children here and give their children the opportunities to be trained here, to live here, to raise their families here, and to work here. And we can do that if we have a very strong partnership with James Cook University. Now, just yesterday, I took the Cabinet to James Cook University, where we were in one of the brand new buildings, setting up Cairns for the future, an innovation centres hub. And I really want to thank Sandra Harding for allowing the Cabinet to meet there, and we put in $10 million into that centre. We know how important this university hospital is. I know how important the staff are in terms of making it function, and we want to go to that next step. So today we are announcing the next step to making Cairns a university hospital. So we will be working with James Cook University on a preliminary business case. We'll be putting $1.5 million into that. Our total funding announcement today is $52.9 million. That'll mean $26.4 million to expand the emergency department. I'm quite sure that some of our our hardworking workers over here from the emergency department know that that extra funding is going to help relieve some of the pressures there. $1.5 million on a multidisciplinary pre-admission clinic, $2 million in a new endoscopy room, $800,000 to fit out a 12th operating theatre, and $20.7 million of critical upgrades to the Cairns University Hospital. And this will mean 150 people involved in the construction as well for this expansion. So this is great news. I know it's something that all of the local members have been raising with me and also with the Deputy Premier, but this is the next crucial step in making Cairns Hospital become a Cairns University Hospital. So my government knows how important the healthcare is for our families, no matter where you live in Queensland. And we know that when we're dealing with COVID and a world pandemic, our hospitals are prepared. We have the resources, we have the staff, and we have the training. And now I want to see a really bright future, especially for people living here in the far north, to be able to live here, raise their families and get the training and the opportunities here. So a very great day, and I want to thank all of the local members for raising this as one of their top key priorities for this region. I'll hand over to the Deputy Premier, then Sandra Harding and the local MPs, and then we're happy to take questions.
We have a very proud record of investing in the Cairns Hospital. I was at D Block just yesterday, and that was a fantastic investment. Right now we have a $70 million construction project underway that you can see not far from us, as well as, of course, the $70 million investment in the Atherton Hospital that is underway right now. And this announcement today is our next step, our next investment in giving Cairns the level of health care and health services that it needs and deserves. And I want to congratulate our local MPs for their advocacy. I want to thank all of the staff of the hospital who are here with us right now and have been working with us to develop this project. A new and expanded emergency department, a new endoscopy suite, another new operating theatre, and a commitment to work with James Cook University in a joint planning process to turn the Cairns Hospital into the Cairns University Hospital, so we can train more clinicians here locally and keep them here locally, delivering more and better health services to people in Cairns, the hinterland and the far north. Cairns is one of our busiest emergency departments, and this is a commitment to expand the emergency department so that we can continue to deliver fantastic healthcare here in Cairns.
First of all, can I say thank you very much, Premier, and thank you, Deputy Premier, for these announcements today, and thank you to everyone who has worked so hard to reach this point. From our university's point of view, we want to work 120% with the Palaszczuk government and with the Cairns community to deliver the Cairns University Hospital. We know what that takes. It isn't simply a matter, as we have right now, of the final 3 years of the medical program being offered through Cairns and at the hospital here with our campus. It is much more than that. The university will be contributing, thanks to funding that was received from the federal government, $60 million towards this major idea of a hospital and this delivery of a hospital that will not only serve the purposes of ensuring we've got an integrated approach to healthcare and clinical care for Cairns and the far north, but it'll also put it on the map in terms of a place where both clinical and research work is done every day. When we can get this right, and we will, by virtue of the integrated planning that we're looking to undertake now to deliver this major vision for Cairns and the far north. When we get this right, not only will we be encouraging students to come here to study their full medical degree in time, we're wanting to get extra places from the federal government to enable that, not just the final 3 years, but in a range of other allied health areas as well, and nursing as well. So not only will we have students come and complete their entire training in Cairns, and we know that students who train in the region stay in the region. We know that. We've established that very, very plainly. Not only, therefore, will we be delivering on that vision of having people trained here and staying here, we will be in a position to attract world-class clinical talent to Cairns. And they'll do that because what we have is a university hospital genuinely engaged in teaching, in clinical research and in broader research of benefit to the Cairns community, but if I might say, Premier, to not only the Cairns community, to North Queensland, to Northern Australia and indeed to the tropics worldwide. This place deserves that sort of reputation. It already is such a strong health service and we're delighted to be working with the health service here, and what we see is really a new era beckoning us with the Cairns University Hospital. We couldn't be happier with this development today. So again, I want to thank the Premier very much. Thank you, Premier. Thank you, Deputy Premier, and thank all concerned. I see Clive Scarrett here, who's been a wonderful advocate as well as the Chairman of the Board. We are just very eager to get on and do this integrated planning so we can deliver on this vision as quickly as possible. Thank you.
Good morning, Premier. Thank you. Good to have you in Cairns again. This is a fantastic announcement. This really is, I stand before you to speak on behalf of my 3 parliamentary colleagues. This is fantastic news. I have to make a little note. I'm seeing the smiles coming from the staff from the emergency department. Richard, well-deserved smile. This is a great outcome. Over the last couple of years, my parliamentary colleagues and I have been meeting with staff in the emergency area, and they've been highlighting what they believe has been needed. So today we fulfil that commitment, but in addition to that, we start the foundations moving towards what is needed at a university hospital. I can't register strongly enough the amount of pride that we as a community have in our staff, and this will ensure that you have world-class facilities. But not only that, we also have, and we will when things get better, we have millions of tourists from around the world that come to our region. Having a world-class facility is vitally important to the Palaszczuk Labor government. It's been a priority and something that we as the local members have been advocating. And as I said, I can't register strongly enough how wonderful this is, not just for the staff, but for the broader community. Over 7,500 people are employed in this enormous driver. It's an economic driver for our city, and this investment reflects the infrastructural investment that the Labor Palaszczuk government continues to make, not just in our part of the world, but throughout Queensland. So, Premier, thank you. Staff out the back, well done, guys. And to my parliamentary colleagues and to the city, better days ahead. Thank you very much.
Thank you, Premier. Thank you. Has anyone got any questions on this announcement?
Premier, I guess how important will this be to, prevent patients from having to travel out of the state?
It's all about the people. Fundamentally, this is about putting the families of the far north front and centre, so making sure that they have the clinicians here. But like I said, it's about allowing people to train here as well. And we know how crucial it is to have people living and staying in the region.
We still need about 160 odd million plus whatever it is to buy the land.
Yeah, but this is the big first step, and you can mark my words, there'll be plenty more to come.
In this election campaign, or does this negate?
Oh, I'm not going to give anything away at the moment. You'll have to wait and see. There will be no changes for the month of September. Oh, that's a very good question. So, of course, Queensland made a very comprehensive pitch to the AFL, and I understand that the AFL may be meeting today, and I hope that they take on board. This is my last thing I want to say before they meet, probably, is that I hope they take on board that Queensland has really been there for Victoria during these tough times. We know when the AFL first floated the idea and the concept of a hub, that Queensland welcomed that idea, and we worked with the Chief Health Officer to make that happen. Since then, we have hosted nearly the entire AFL competition. And we also know that AFL is growing in Queensland, and Cairns loves the AFL. We've just got a few teams that are coming here to continue in that competition. So hopefully they'll give due consideration to Queensland, and I've got my fingers crossed. And I just want to say that if Queensland is fortunate, we know it is just this once, and it is to look after the AFL whilst Victoria is going through a very difficult time. I don't know, but I'm hoping that I get a call if we're successful. But look, we've put in, I think, a very comprehensive plan, and we'll wait and see. But look, it's can I just say it's tough for Victorians at the moment. You know, we know how much they love this game. I've asked Queenslanders to adopt a second team as well from Victoria, and you know, I've just got my fingers crossed.
On the border review,
Because we said we review it at the end of each month, and there has been no advice from the Chief Health Officer to change what we are doing.
Can you tell us what you're looking for? Are you looking for no cases per se? What are you looking for when you make those decisions?
I'll tell you what we're looking for: to keep Queenslanders safe. That's what we're looking for.
Businesses want a bit more certainty around. Are you looking for 0 cases? Are you looking for no cases?
Yeah, well, because the health commissioner, Dr. Young, our Chief Health Officer, has made it very clear that she doesn't want to see community transmission, and there is community transmission at the moment in the southern states. Yes. We've been putting a lot of investment into the far north, over $1 billion in roads. I think Craig Crawford was telling me nearly every school in his electorate was basically getting upgrades in terms of education. And of course we know how important health is, and we've been focused on our COVID recovery, but also we've also been focused on growing the workforce to ensure that we've got the nurses and the doctors and the allied health professionals. That is exactly what we need. And now we are focused on partnering with James Cook University. And to that extent too, I want to thank each of the local members up here. They have really been pushing this. It's a great win for them. And I also want to thank Advance Cairns, Sandra Harding, Nick Trump, that Cairns convoy that came down from Cairns to Brisbane, met with the local MPs, and the local MPs brought them in to see both myself and the Deputy Premier. Look, I'll have to get some further information from Commissioner Martin. My preliminary advice is that there was some disturbance. Of course, it's a very difficult situation at the moment. It is absolutely fundamental that we try to stop the spread of COVID in our prisons. That's why these tough measures have had to be taken. But I might get Commissioner Martin to talk about the operational issues in relation to what happened. Yeah. Sorry?
What's the plan to de-escalate?
Yeah, well, they're trying to make sure, I'll get Commissioner Martin to talk about that. Yeah, we don't want to see that happen, but it is very difficult times at the moment, as you can appreciate, because they're in a quarantine to make sure that there is no COVID in the prison. So this is part of our COVID safe plan, and as I've said to Queenslanders, we have put in place comprehensive COVID safe plans across Queensland to make sure that when there is a potential outbreak, we can actually respond very, very quickly.
Are you aware of an incident where people were dancing on tables in a pub in Roma?
No, I'm not aware. Thank you for raising it. I'm happy to get authorities to look into it, but this is not the time to be dancing on tables. I'm sorry. Everyone has to be seated. It's part of the COVID safe plans, and the owners of that hotel have a duty of care and an obligation to make sure that the COVID safe plans are being followed.
In terms of the border, obviously it's a long time away in Victoria before we see no community transport. Are you able to give any update on when we might be able to open to New South Wales?
No, Dr. Young has said very clearly that she doesn't want to see community transmission, and there's still community transmission in New South Wales.
And is that for a month period with no community transmission?
Well, she has said 2 cycles, Jess. Yeah. She said that before in press conferences.
Michael Healy's been pushing for a multi-million-dollar upgrade to the diversionary centre here. Is there any chance that we're going to see some funding rolling for that over the next couple of days?
Cabinet ministers are still around for a couple of days, so I'm quite sure he'll be speaking about that to ministers on the ground.
CCIQ has said that your economic plan is a rehashing of old ideas. What do you say back to that?
I say that CCIQ is part of our alliance where we're all working together on our strong plan for economic recovery, and they have been working with us. And if they have any other ideas to put forward to the alliance, I'm more than happy to discuss it with them. But they have been part. What I did, this is, I don't think this has happened anywhere else in Australia. We actually sat down with all of the peak groups, including AgForce, CCIQ, we've got industry leaders, the Resources Council, we've got the Conservation Council, we've got everybody working with us on our economic recovery plan. And that economic recovery plan that I launched at CEDA was the joint work of not just government, but working with industry and everybody else to make sure that everyone is focused on getting Queenslanders back into work. It's a very tough situation out there. Don't think I don't know it. Don't think I'm not out there talking to people and hearing what their stories are and hearing how tough they're facing it. And we had a meeting just yesterday too with all of the Indigenous mayors as well. It's tough in their communities as well. And what they're saying to me is the worst thing that can happen to them is to get COVID into their communities, because COVID would have a huge impact not just on the families in the communities where they are more vulnerable, but also on any long-term economic recovery plan.
If CCIQ worked on the plan, what do they think it is for?
We have to ask them. They're part of the alliance. They're part of it.
It's neither visionary or detailed.
Well, I reject that. It's the most comprehensive plan that any Premier has released. Okay? Thanks, everyone.